Now, you won't be surprised to hear that so many more of us are returning to alternative therapies with our crazy busy modern lives. We talked to Mairead Fahy, who is an acupuncturist and a Chinese herbal medicine expert, on the benefits and the ailments it can cure.
Well, acupuncture has been around for a long time. They say, well, they don't actually know how old it is, but the theory goes that it's about 4,000 years old. Discovered in China, or so they say, and again, we don't know for sure, but that's the theory. So it's a very ancient, traditional form of medicine, which has become very contemporary and been brought up to the modern day and been used very contemporarily in the modern medicine, and it is used as a medicine in both West and East.
So people, when they think of acupuncture, they think, oh, needles, I'm going to be like pincushion. It's not that at all, is it? It doesn't hurt or anything.
No, it's not. I always say it's not like having a blood test or having blood taken, or it's not like having an injection, not in the slightest. The needles that we use are very fine, very sterile, very hair-like, thin, fine needles. As I said, they're all sterile and they're all disposable. But to answer your question, people will feel something, but it certainly isn't pain. There will be a sensation of the needle being inserted and a sensation of sometimes heaviness, sometimes tingling, sometimes warmth, sometimes a sensation of, ooh, something happened there. But that's it. And it really is momentarily, and no more than that.
Tell us about some of the treatments and some of the ailments you would actually treat with acupuncture.
Well, I always say that acupuncture treats everything and can do everything except make tea. So it can do everything except make tea. So basically, when you go to a GP with something, with an ailment, with a problem, with anything like that, in a very traditional form, acupuncture can do the same thing, but without drugs. So without medication, acupuncture can treat that symptom or whatever it is. The difference, I suppose, between acupuncture and traditional Chinese medicine versus traditional medicine or allopathic medicine is that with acupuncture and traditional Chinese medicine, we always go back to the cause of the problem. We treat that rather than just the symptoms, and that's what stops the symptoms reoccurring or changes things within the body so that symptoms don't come back. Some of the most important things, or the most sort of common things, I guess, that acupuncture can be used for is pains and aches and stuff like that. That's probably always been there. But one of the most important and probably most vital sort of treatments that we use acupuncture and traditional Chinese medicine for is fertility. So that can be anything from helping the lady become sort of balance her hormones, both men and women, not just females, but men are just as important.
Well, and it also, you cover everything from weight loss, anxiety, migraines, tummy problems. It is just a whole holistic approach to healing any ailment at all.
That's what I say, acupuncture can do anything except make tea.
And just quickly, just about, you've set up the very first acupuncture community here.
Oh, community acupuncture, yes, community acupuncture. It's a small movement that's kind of been gathering momentum, particularly in the States, and there are some clinics, community acupuncture clinics in the UK as well. But I'm probably the first one in certainly the southeast. I think there's one or two more in Ireland, but not that many.
And that's making acupuncture affordable for people who think it might be out of their price line.
That's it, exactly. It's what it is the way they do it in China. In China, acupuncture has always been a community treatment or a community medicine, and it's probably bringing it back to its roots, to that area.
So a group of maybe 6 people, 10 people will come along and they'll all get treated together in the one room?
That's it, exactly. They get treated sort of very much like if you were in a ward, a hospital ward or whatever, I would go around and just sort of treat people and stick needles in people and move from one to the other quite rapidly. And that is kind of what keeps costs low. I tend to use it specifically for pains and aches and, you know, sort of migraines and things like that, things that can be treated quite quickly.